At Ohio Skin Center. Today we're going to go over some brief instructions on how to care for your wound site after you've had surgery here in our office. When you leave our office after surgery, you will have a big bulky bandage in place for 2 whole days, meaning 48 hours. We will give you a set time to take your bandage off. For the first 2 days, you are allowed to shower, but you will shower below the wound site of your surgery. Then, when 48 hours is up, you will then be able to shower like normal. Shampoo, body wash, your normal shower routine is fine, but clean your wound site last. That way, if there's any residue, you will get that out before you get out of the shower, and use a separate washcloth to clean your wound every single time. When you get out of the shower is when you start the first step of the wound care.
I'm going to show you how to take care of your wound after surgery. After 48 hours, you're going to remove the old bandage. You can wash with soap and water. You can also use the vinegar solution that you were given instructions for on the day of your surgery. Soak a piece of clean gauze in the vinegar solution and soak your incision with the solution. After you've done that, you can use a Q-tip, apply some Vaseline, and recover the area with a new bandage. You can use gauze and tape or a large Band-Aid if that fits.
Few things to watch out for after surgery. One being swelling, bruising, and also pain. With the swelling and bruising, that is normal after surgery. If the area that we operated on was on your head or neck, we would like you to keep elevated for the first few days, whether you put a few pillows behind you in bed or sleep in a recliner for the first few nights. You can also start icing the area right away. Just take an ice pack and you can ice that 20 minutes out of every hour if you'd like to. For pain, Tylenol is usually fine for most patients, and you can take that as needed for pain. One of the other things to watch out for is signs of infection. So if you see green-yellow drainage, have a funny odor, some redness is also normal after surgery. That's from the site itself. But if you notice the redness spreading, you are getting fever, pain, chills, the area is hot to the touch, then I would like you to give us a call. Last thing to watch out for is bleeding. A little bit of bleeding or drainage is normal after surgery, and that is perfectly fine to have. But if the bleeding is in excess, where it's saturating through the bandage, it's running down the area, then I would like you to take the bandage off, get a dry towel, a dry washcloth, something along those lines, and hold firm pressure on the area for 20 minutes uninterrupted without peeking. Set a timer for 20 minutes and do not let go until that timer goes off. If afterwards the bleeding is still continuing, then give us a call. There's 2 separate phone numbers on the papers that you're going home with, one for an in-office emergency. There's also one for an after-hours emergency, so you are able to get a hold of us if it is past after hours. Give us a call if you do have any questions though.